Hi, namaskar dear students and good morning. Today we are going to discuss about the heart failure. Heart failure is considered as one of the most important concept for your exam preparation. Regardless you are preparing for the which licensing exams, FPG, NEPLEX, PVC, OPRA, KPS, GPHC, whatever exam that you are planning to write, heart failure is considered as the most important concept for your exam. So you have to give extra focus on learning a heart failure. Before we start getting the better understanding about the heart failure, we should have to get the foundation of all the physiological understanding of the heart function, and based upon that we have to dissect certain terminologies. First of all, we have to understand the heart failure. Okay, when we are talking about the heart failure, the failure means the normal function is not carried out. So what is the normal function of heart? Is pumping. Okay, so pumping is not happening properly, that means the heart failure. Another term that we are commonly come across is called the congestive cardiac failure. Okay, congestive cardiac failure means when the heart is not pumping properly, so fluid is start getting accumulated and it's becoming congested inside the body. That's why that's another term is called the congestive cardiac failure. Okay, so let's we understand very simple and fundamental principle about the heart failure. Okay, let's assume this is your heart. This is your left ventricle, this is your right ventricle. For example, this your left ventricle is not functioning properly. That means what happened? These muscles are not pumping properly. That means the fluid is not getting out. That means that's called the ejection fraction. Okay, that's the ejection fraction is reduced. Now, the first term is ejection fraction. Ejection fraction is mainly depend upon the left ventricle, because the left ventricle is pump out blood in your throughout body. So if the left ventricle is not pumping properly, that means the ejection fraction is decreased. Okay, this is a very important term that you have to remember. The second thing is, if left ventricle is not pumping properly, so the fluid is start getting accumulated here. That means the fluid is not receiving from the left atrium. Fluid is not receiving from the left atrium. So the left atrium is not received fluid from lungs. That means if the patient is suffering from the left ventricular problem, in that situations the lungs start getting accumulated. So the lungs is filled with the fluid. So majority of the symptoms that associated with your left ventricular failure is related to the lungs related problems. That means shortness of breath, coughing, okay, crackle sound. When you are lying down, at that time you feeling the more shortness of breath. These kind of symptoms are associated with the left ventricular failure. So in your examination you might get the questions like, the patient is suffering from the left ventricular failure, all of the followings are the symptoms associated with it except. So you should have to get the better understanding. Left ventricular failure means the fluid is accumulated in your lungs, and the lungs related symptoms are the major symptoms. The second thing is the right ventricular failure. If the patient is suffering from the right ventricular failure, right ventricle is not pumping properly, that means the right atrium is accumulate with the fluid. That means right atrium is not receiving fluid from the body. So more congestion in the body. That means the major part is jugular vein. Okay, so that vein is distension, fluid is accumulated. So jugular vein is distension. Second is your liver is accumulated with the fluid, so liver hepatomegaly. Third is major, your legs, foot is pedal edema, is edematous condition at your lower part of the body. Okay, so swelling in your legs, hepatomegaly, jugular vein distension, these are the symptoms associated with the right ventricular failure. So clear definition, first of all you have to understand the left ventricular failure, right ventricular failure. The second point is what are the symptoms difference, left ventricular failure, major symptoms related to lungs, right ventricular failure, major symptoms related to the peripheral body fluid accumulation. So now you understood why this is called the congestive heart failure. What is the difference between the left ventricular and the right ventricular problems? The third problem is systolic and diastolic failure. Okay, systolic means the left ventricle is pumping out. That's called the pumping out. This is the systolic. Diastolic means left ventricular feeling. Okay, so that's the feeling related problems or pumping out related problems. So based upon that, they clearly define the ejaculation fraction is less than 50% of the normal. So this is the one type of heart failure. Nowadays they are not using terms like left ventricular or ventricular failure or systolic heart failure. They are using the term ejaculation fraction. Based upon that, they have defined the heart failure with reduced ejaculation fraction and heart failure with normal ejaculation fraction. Okay, so based upon that, they are classified heart failure in two different terms. This is very basic terminological understanding. Okay, that is the first point that you have to keep in mind. The second thing is, now you have to learn and understand the entire body in an integral form. This is your central nervous system. For example, this is your heart. Okay, this heart is connected with the blood vessels. These blood vessels are connected with your kidney. Okay, so if heart failure, that means heart is not pumping properly, so they are not generating enough pressure. These blood vessels, they contain baroreceptor. These baroreceptors are getting signals heart is not pumping properly. That means they are giving signal to the central nervous system, and they increase the flow of sympathetic. Now the sympathetic system is activated, and the sympathetic system is going to stimulate your heart through the beta 1 receptor. They are stimulating the heart. Second, this sympathetic system is also causing the vasoconstriction and exert the pressure. So exert the pressure, and also they are doing the same time, they are increasing the cardiac output. So these two combinations are trying to maintain and compensate the normal heart failure function. Okay, this is the one compensatory mechanism. The second compensatory mechanism is the brain is getting signal, we don't have enough heart outflow. The heart is not pumping properly. That means might be they are short of fluid. Okay, so in that situation, the brain and pituitary gland is release the anti-diuretic hormone, and these anti-diuretic hormones are start retaining more water, and that increase the fluid retention. So this fluid retention is again increase the fluid, and they are trying to maintain the normal pressure and normal hemodynamic situations. That is the second compensatory mechanism. The third compensatory mechanism is heart is not pumping properly. That means the kidney is not getting enough pressure, is not enough perfusion at the kidney. They increase the renin release, and same time the renin-angiotensin system is get activated. This renin-angiotensin system is increase the angiotensin 1 to angiotensin 2 conversion. This angiotensin 2 has a two unique function. One is that is a vasoconstriction, and second is that increase the aldosterone level. This aldosterone is causing the water and sodium retention and potassium excretion. Now, vasoconstriction and fluid retention, normally vasoconstriction, fluid retention and sympathetic system. All these compensatory mechanisms, they are trying to maintain the normal cardiac output through different mechanisms. That is called the compensatory mechanism. This is very important part for learning heart failure. Okay, so if you are going to make a broad list of the medication that use for the management, the one kind of medications that from the sympathetic, that is called the beta blockers. Okay, second class of medications, that is vasoconstriction, so the vasodilatory medications. Third class of medication, that's the water and fluid retention, so loop diuretics. Fourth is renin-angiotensin system is activated, so renin-angiotensin system related medications like AC inhibitors, ARBs. Okay, also aldosterone concentration is high, so aldosterone antagonist. This is another class of medications, and two other medications that related to the overload of fluid. Okay, so fluid overload, that is glucose, sodium and glucose co-transport inhibitors. These kind of medications are actually used for the diabetes, but in these patients also they are flush out the glucose from the body, and they are trying to maintain the osmosis and that increase the fluid outflow, water outflow. Okay, so these are the class of medications that normally use for patients those who are suffering from heart failure. So here when we are talking about the vasodilatory medications, that's the artery dilatory medications like hydralazine, and also the venodilatory medications like nitrates. So these are the group of medications that normally use for heart failure management. Now, you have to better understand all these concepts. This is the foundation. Okay, so based upon that, you have to understand one more thing, that's called Frank-Starling mechanism. Let's assume this is your left ventricle, okay, and this is your blood vessels. For example, this is your artery and this is your veins. Okay, now this artery is constricted means this is narrowed down. In that situation, the fluid is here. This wall has to exert the pressure on this fluid. Okay, this wall has to exert the pressure on this fluid in order to get out from the left ventricle to these blood vessels. Okay, but this blood vessels is constricted. That means this wall has to put a more pressure on this fluid. They have to exert the more pressure onto this fluid, and due to exerting more pressure, this wall has to become more thicker. Okay, this wall has to become more thicker. So if the wall is thick, that means that is going to exert the more pressure. This phenomena is called the left ventricular hypertrophy. This hypertrophy is because of the uncontrolled hypertension. Patient is suffering from the hypertension and that is not controlled in a proper manner. That means that is causing the left ventricle to become more thick, and that is called the left ventricular hypertrophy. Another way, if the more fluid is coming down, so the more fluid is here, this more fluid is exert more pressure onto the wall. This more pressure exert onto the wall. This wall has to sustain and withstand against that pressure, that has to be more thicker. Okay, so in that situation also that is causing the left ventricular hypertrophy. But one thing is the pressure out exertion and one is the pressure onto the wall. So this is called preload. This is called afterload. Okay, so preload reduction can be done. Preload reduction can be done by the venodilator. So if we are going to dilate the veins, that are going to accumulate more fluid inside the vein, and the less fluid come to the left ventricle, and left ventricle wall feel more relaxation. So the venodilatory medications are considered as the preload reducer medications, and the artery dilators. If the artery is dilated, the left ventricle wall has to exert less pressure to come out the fluid from the left ventricle to the outside. That is called the afterload reducing medications. So another term, preload and afterload, is very important. And this left ventricular hypertrophy, that is also very important. When the left ventricular hypertrophy is continuously growing and developing, that ultimately and eventually that become the heart failure. Another term, this the wall, like it's a simple philosophy and physiology. The elastic band is when we are stretching the elastic band, that is getting out with the force. Okay. Another, if the more thicker elastic band, that is a more power. So elastic band is continuously becoming more thicker and thicker, and this wall is become more thicker. That is called the Frank-Starling mechanism. That's called the Frank-Starling mechanism. So all these are the bits and pieces of the information so far we have discussed. These are very, very essential and important for building your foundation. If you are ready with all this information, you feel more comfortable to understand heart failure. Okay, let's jump into this concept. Okay, now we feel more comfortable to understand. Now the physiology, pathophysiology or the heart failure, there are two possibilities. One is decrease cardiac output. If the decrease cardiac output or increase the cardiac demand, that means heart is functioning normally. But if we put extra requirement, or if we are giving an extra job to the heart said, okay, I can do normal function. If you are going to give me the extra work, I cannot do it. That's called the high output cardiac failure. High output cardiac failure. What is the example? For example, if patient is suffering from hyperthyroidism, okay, or patient is suffering from anemia. So in that situation, what happens? If the patient is suffering from anemia, that means the less number of RBCs are there, so the patient, like heart has to function more for providing the same amount of oxygen at the cellular level. That means heart is functioning normally, but due to lack of oxygen carrying capacity or less RBC, that put more pressure on heart. That's called the high cardiac demand. The similar way, if the patient is suffering from hyperthyroidism, in that situation, the extra metabolic requirement generated in the body. That's the extra requirement generated in the body. That means that required more oxygen, more fluid, more nutrient. So heart has to function more. That is called the high output cardiac failure. So we have defined 6 different terminologies for the heart failure. One is left ventricular hypertrophy, left ventricular heart failure, right ventricular heart failure, then systolic heart failure, diastolic heart failure with reduced ejection fraction, and heart failure with normal ejection fraction, high output cardiac failure and low output cardiac failure. So these are the terminology you should have to get the basic and minimum understanding. There are two possibilities of causing the compensatory mechanism activate. So there are three compensatory mechanisms that we have discussed. One is your blood vessels, baroreceptors are getting sense, we don't have getting the enough pressure. That means they increase the sympathetic tone. That increase the sympathetic tone, that means they are releasing more noradrenaline. This more noradrenaline, that is causing two things. One is that increase the peripheral vascular resistance, means the vasoconstriction, and second is they are causing positive ionotropic and positive chronotropic effect due to beta 1 receptor, and this is due to alpha 1 receptor. Now the second thing is your hypothalamus and posterior pituitary gland, they are getting signals and they are come for the rescue of your heart, and they release the antidiuretic hormone. This antidiuretic hormone, they are water reabsorption from the kidney and volume expansion is executed. Third is kidney is not getting enough fluid, renin release, angiotensin 1 to angiotensin 2, aldosterone. Okay, and this angiotensin 2 has a two function. One is aldosterone and second is increase the vascular resistance. This aldosterone, sodium and water reabsorption. Sodium and water reabsorption. Now you can combine all these things. There is a volume expansion. Volume expansion. This volume expansion is causing the Frank-Starling relationship. That means what? The volume expansion is exert more pressure on your left ventricle and ventricle wall become more thicker because to withstand against that volume. And this vasoconstriction also required more pressure need to be generated by the left ventricular wall, and due to that the Frank-Starling mechanism is executed. So now based upon this pathophysiology, you can clearly understand what are the different kind of medications are used for the management of heart failure. Beta blockers, angiotensin converting enzyme inhibitors, atrial dilators like hydralazine, spironolactone kind of substance like aldosterone antagonist, digitalis like digoxin for improve your cardiac output, diuretics for the water, nitrates for venodilatory, and angiotensin receptor blockers. Okay, so these are the list of medications based upon the physiology you can get understand. Okay, it's all the physiology and pathogenesis we have discussed. Now we can come to the clinical practice. Okay, clinical practice is very, very important to get the actual practical understanding how you are going to manage the patients. Heart failure with the reduced or the preserved ejection fraction. So ejection fraction is the most important part for your guideline of the management. Now heart failure can be divided into two groups. One is the heart failure with the reduced ejection fraction and heart failure with the preserved ejection fraction. Definition is based upon the ejection fraction. Left ventricular ejection fraction is less than 50% or is more than 50%. If it's considered less than 50%, that means that is a severe situation, severe condition. Okay, and if it's more than 50%, that means still the myocardial muscles have capability of the contraction and the good functionality are there. So this is the baseline of the definition, formerly known as a systolic heart failure. Why systolic? Because systolic is based upon getting out. Okay, getting out, that is a systolic. Diastolic means filling up. Okay, so left ventricular, formerly known as the diastolic heart failure. The main focus medication guidelines, very, very important in both the situations, but nowadays in a current treatment regimen, SGLT2, this is the most important substance considered in today's time for the management of the heart failure. Originally this medication was used for the diabetes. We are going to discuss this in a later on, but first of all you have to understand the two different class of heart failures based upon left ventricular ejection fractions. Okay, now why we are using and managing the heart failure? What are the rationales for the using the drugs? First of all, relieve the symptoms. The patient is suffering from heart failure and getting the symptoms, so we just have to read off all the symptoms that related to heart failure. Second important thing is improve the exercise tolerance. What is the meaning of exercise tolerance here? Exercise tolerance means the patient should carry out the normal day-to-day life activities. Okay, and if in day-to-day life activities the patient is exerting pressure on the heart, and heart should have a capability of the handling those pressure, and they can live their normal life. That is our main objective. Okay, prevent hospitalization and left ventricular function deterioration minimize करना है. These are the objectives. Okay, and reduce the mortality due to the heart failure. This is the main rationale behind using the drugs. Before we start treating the patients, we have to rule out the possible cause of the heart failures, like evaluate the specific cause: coronary artery disease, hypertension, valvular disease, acute myocardial infarction. If the patient had a strong myocardial infarction and due to that the significant region of the myocardial muscles has been damaged, due to that the patient is suffering from the heart failure or arrhythmia. These are the important part. Anemia, if the patient is suffering from anemia and we are treating all of the things, it's not going to work, because the fundamental cause is putting extra pressure on your heart. So in that situation we have to address the anemia, and when we are going to address the anemia, automatically that cause the relief to your heart. Certain infections that can cause these problems: thyroid dysfunction. Okay, hyperthyroidism exert more pressure on your heart. NSAIDs, sometimes NSAIDs are retaining more sodium and water, and due to sodium and water extra retention they are causing the fluid overload, and due to that might be patient can experience heart failure. Verapamil, that is also reduce the cardiac output, excessive fluid and salt intake. So possible all the reasons need to be evaluated, and on based upon that we have to make a treatment plan. Okay, but the drug treatments, these are the medications normally used for the management. Very critical kind of heart failure is called the heart failure which is the reduced ejection fraction. In your examination recently, this is the most important question that you have to keep in mind. That's called the quadruple therapy. That means the 4 drugs must be started in the patients, those who are suffering from reduced ejaculation fractions with the heart failure. Okay, so one is renin-angiotensin system inhibitors. One drug need to be from that particular group. Second is beta blockers. Third is aldosterone antagonist, and fourth is SGLT2 inhibitors, sodium glucose cotransporter 2 inhibitors. These are the 4 medications. That's why it's called the quadruple therapy. So in your examination might be you are going to get the questions like which of the following medication is not a part of the quadruple therapy. So in that situation you should have to identify the which medication is not part of that. Okay, loop diuretics are the symptomatic relief, but it's not the mandatory part of that. Okay, so these are the 4 medications. Okay, now try to understand. Already we have covered the beta blockers. In hypertension we have already covered that. Renin-angiotensin system medications, already we have covered those group of medications. Okay, aldosterone antagonist. Aldosterone antagonist also we have covered, like spironolactone and eplerenone. These medications also we have covered. This SGLT2 inhibitors in detail we are going to cover, because this medication is primarily considered as a diabetes medications. Okay, but here in heart failure patient, regardless of the diabetes, if the patient is suffering from diabetes or not suffering from diabetes, we have to start with this medication. Okay, so this medication we are going to detail medication covered in diabetes. Okay, so all the patients need to be started with this medication unless it's contraindicated. Start early with low dose and titrate to the higher side. Loop diuretics. Loop diuretics are considered as a congestion control medication. That means the excessive fluid accumulation need to be controlled with the loop diuretics. Okay. At thiazide diuretics, if the fluid retention is there. So this is the best management plan that you have to keep in mind. Now, renin-angio, quickly we can go through all these medications. Renin-angiotensin systems, what are the key points you have to understand? Improve the symptoms, reduce the hospitalization and prolong the survival. So ACE inhibitors are very, very important part of the regimen for the heart failure management. Start early with the low dose. Always watch for the hypotension, especially in elderly patients and those who are on diuretics. Because the patient is already in diuretics and they are taking the ACE inhibitors, they are more prone to develop the hypotension. Titrate the medications after 2 to 4 weeks. Already we have discussed in detail about the ACE inhibitors, so it shouldn't be any problem to understand at this part. Okay, sacubitril and valsartan. This medication is in a combination. Okay, sacubitril, this medication has a unique kind of mechanism that increase nitrile peptides. That means when we have understood the pathology of the heart failure, sodium and water retentions are the major part that involved in the heart failure patient. Okay, so this medication is helping to flush out the water and sodium. That means is a partial diuresis effect, and also the losing the sodium, so it's a vasodilatory effect. Okay, but is mainly acting on increasing nitrite peptides concentration increase. Okay, and valsartan, we know valsartan. Okay, this combination is superior than enalapril, reduce the cardiovascular death, hospitalization and survival. Start with the low dose, monitor blood pressure. Okay, vasodilatory effect, so we have to, and also the diuretic effect and antihypertensive medications. If the patient is taking any other antihypertensive medication and diuretic medications, we have to carefully monitor and might be required to adjust the dose of diuretics and antihypertensives while we are starting with these medications. And the sartans, if the patient is suffering from dry cough problem with the ACE inhibitors, in that situation we can change to sartans. Okay, so these are the 3 different medications came from the group of which kind of medication? Renin-angiotensin system inhibitors. So we have to select any of these medication. The first line medication considers the ACE inhibitors. If the ACE inhibitors is not taken by the patient, in that situation sacubitril with the valsartan combinations. But nowadays this combination is more commonly used, and if the patient is not tolerate either of the medication, then we can start with the other sartans. Okay, second type of medication is beta blocker. Why we are giving beta blockers here? Because of the cardiovascular system is not functioning properly and is a excessive sympathetic tone, and we are going to control the excessive sympathetic tone. But there are 3 specific beta blockers are used in this situation. One is bisoprolol, carvedilol and control release metoprolol. This medication reduces the mortality and hospitalization. If the patient is suffering from low or reduced ejection fraction, though patient is elderly, other problems, erectile dysfunction, diabetes, COPD, in that situation also we have to think about the beta blockers. Okay, start with the low dose, and start with the low dose because the beta blockers are going to reduce the ejection fraction and blood pressure at the beginning. So when the patient is becoming euvolemic, that means what? The patient blood pressure and the cardiac output become normal, hemodynamically patient become more stable, then we have to increase the dose. That is very, very important, because the beta blockers are reduced that is a negative ionotropic and negative chronotropic effect. Okay, so initially we have to start with the lowest possible dose. When patient become euvolemic, always U ka matlab is normal. Okay, when patient is become normal hemodynamically, then we are going to increase the dose of beta blockers. Aldosterone antagonist. Aldosterone antagonist, spironolactone has a more hormonal side effects. That's why spironolactone is less preferred compared to eplerenone. Eplerenone is more specific medications. But when we are giving aldosterone antagonist, always we have to keep in mind with potassium level increase, okay, because that is causing the opposite effect than the aldosterone. So they cause the hyperkalemia. When combining with the aldosterone antagonist and ACE inhibitors, again the potassium, these are also increase the potassium level, this is also increase the potassium level. So is when the patient is taking this kind of medication in combination, then always we have to be very careful about the potassium level. Okay, SGLT2, this medication is mainly acting at the kidney, and they are like normally what happen, for example, this is our blood, okay, and there is sugar, this is kidney. Sugar means is glucose, okay, this is kidney, this is urine output, okay. So this sugar, glucose is coming to the kidney for filtration, and that is going to be reabsorbed, okay, this is going to be reabsorbed. So in normal situation, if the patient is patient blood, like a plasma blood glucose concentration is less than 180 milligram per deciliters, that is not going to be filtered out. That means in your urine, glucose is not coming out. But if the concentration is higher than that, that means 185. So the 5 milligram per deciliter is higher, that is going to be excreted in urine. Rest of the glucose is going to be reabsorbed. But when we are giving this kind of substance, okay, they are inhibiting this pump, and they expel out the glucose from your body. So when the glucose is coming out from the body, what happened? That is again the osmosis change, and along with glucose, that also more water is expelled out from the body. Okay, the second thing is when the glucose is less in the body, so all the cells are try to adopt the alternative fuel sources like ketone, and they improve their functionality. Okay, so nowadays this medication is considered as a very good medication regardless of the patient, those who are suffering from diabetes. If the patient is suffering from heart failure with the low ejaculation fractions, in that situation without or with diabetes है या नहीं है उसका कोई मतलब नहीं है, but this medication can be given. Okay, dapagliflozin, okay, dapagliflozin, this medication empagliflozin. Okay, so these medications are group of SGLT2, and mainly this medication used for diabetes, but nowadays that used for the heart failure with the low ejection fraction. This medication can cause diuresis, dehydration and hypotension, monitor the fluid balance and reduce the diuretic dose. So that is also making sense why that happened. Okay, so loop diuretics, again fluid retention, first choice in ejection fraction low hai, so definitely the fluid is more going to be accumulate. No direct evidence in mortality, but monitor clinically for the volume and electrolyte balance. Minimum effective dose we have to use. Normally loop diuretics we have covered in diuretic section. The most important medication in coming class we are going to discuss is a digoxin. Digoxin is very important, and we are going to discuss it in details. Okay, so that's reduce the hospitalization clinically, stability, exercise capability increase. Digoxin is very unique medication. There's negative chronotropic and positive ionotropic. So positive inotropic, that's why that's used for the heart failure. Negative chronotropic, that's why that's used for arrhythmia. Okay, that's why this is a very unique medication, low therapeutic window, toxicity chances are very high. And also we are going to touch upon the ivermectin and this medication as well. Okay, but that's in coming class we are going to discuss. What are the key practice points for the management of heart failure? Okay, as we have discussed, the patient is suffering from heart failure. Now it's stabilized, but for example, it start getting deteriorated. Okay, if start getting deteriorated, then compensatory mechanism is start activated. Compensatory mechanism is start activated. This means water retention is start happening. Okay, water retention is start happening, so the weight is start increasing. That means all heart failure patients must have to maintain the weight diary. Okay, daily weight monitoring, and they have to write down the today's weight. Okay, for example, is the date and the weight continuously in 2 days. For example, 2 kilogram weight is increased, that means that body is start accumulating more fluid. That means might be the heart failure symptoms are going to develop later on. So if this happen, immediately patient can talk to the doctor, and doctor can increase the loop diuretic concentration for couple of days, and excessive fluid can rid off. Or also the doctor is going to evaluate what the cause behind the exacerbation of the heart failure. Okay, so all these things is possible if the patient is going to monitor the weight on a regular basis. 2 kilogram increase in 2 days, that indication of the fluid retention start happening. Consider non-drug measures like regular exercise, cardiac rehab, salt, fluid and alcohol restrictions, smoking, stop smoking. All these things are very important. Dose titration by the specialist. When the patient is suffering from iron deficiency anemia, always we have to correct the anemia, and the iron concentration need to maintain normal. Okay, so all these things are going to get the better management of the heart failure. I hope you have enjoyed today's class. Today's class is pretty straightforward, pretty simple. Entire class has been divided into 2 parts. The first we have discussed about the basic terminology and basic physiology. Once you get the better understanding about the basic physiology and the pathogenesis, after that you can try to understand the management guidelines, so you get the maximum out of the class. Okay, thank you very much for joining today's class, and have a great time. See you in the next class. Bye bye, take care.